Gentlemen, if ejaculation feels painful, burning, or achy, there's a good chance your pelvic floor muscles are involved. And in many men, the biggest culprit is actually overactivity of two specific muscles, the bulbocavernosus and ischiocavernosus. As a men's pelvic floor physiotherapist, in the clinic, when I tell men about the role of these muscles, they often say, "I've never even heard of these muscles in my life." No, I'm not making this up. As men, we do have muscles down there, and they play a huge role in pain during ejaculation. The bulbocavernosus and ischiocavernosus are muscles that are located at the perineum, that spot between the anus and the testicles. When you go to contract your pelvic floor, these muscles can be felt by placing your fingertips on the perineum. These muscles help create rigidity during ejaculation and generate the rhythmic contractions associated with orgasm. So if these muscles are tight, overworking, or hypersensitive, every ejaculation can repeatedly irritate the same tissues. It's not uncommon for me to hear that when men go to the doctor for this issue, they're often told, "Your tests are normal," or maybe it's prostatitis, or they're prescribed neuropathic pain inhibitors that only mask the problem, rather than receive any education on how these muscles can be causing pain. And while medical causes absolutely need to be ruled out first, many men are never told that their pelvic floor muscles themselves can become irritated and overactive. So as a men's pelvic floor physio, I'm often asked why ejaculation can become painful in the first place. Sometimes it can be due to a traumatic event, like trauma to the genitals, and the body just doesn't recover on its own. Or it can be atraumatic, and more to do with chronic holding patterns in the pelvic floor, such as if they are constantly contracting maximally or bearing down in the gym. Men who carry a lot of weight through their abdomen or have a history of inguinal hernias also may experience more discomfort here. Whatever the reason, it's painful, it sucks, and more importantly, we need to know what we can do about this. Research supports a strong relationship between pelvic floor muscle function and male sexual function. Studies have shown that pelvic floor dysfunction is associated with painful ejaculation, pelvic pain, erectile dysfunction, and even premature ejaculation. We also know that many men with ejaculatory dysfunction have poor awareness, poor coordination, or excessive tension in the pelvic floor muscles. So this isn't all in your head. With chronic pelvic pain, there's good evidence through MRI studies that show that mapping to the pelvic floor muscles becomes lost, leading to suboptimal recruitment and relaxation. In short, pain on ejaculation is a real muscular component driven by the nervous system that often won't resolve on its own. Here's the simplest way to think about the ejaculation process. It is a series of rapid, involuntary, submaximal pelvic floor contractions, and the bulbocavernosus muscle is heavily involved in these contractions. The ischiocavernosus can also contribute, especially if there's tension near the base of the penis or pressure along the perineum. So if these muscles are already irritated, short, spasm, or guarded, ejaculation repetitively loads the exact tissues that are already sensitive. For some men, this creates sharp pain, burning, pain at the tip or the base of the penis, or lingering pelvic tension after ejaculation. This is why many men with painful ejaculatory function often come in with a host of other problems, such as hard flaccid syndrome, pelvic floor tightness, increased urinary frequency, constipation, pain while sitting, or just general hip, low back, and glute stiffness. Of course, it's always important to go to your family doctor first for a checkup, as painful ejaculation can be driven from medical conditions such as prostatitis, urinary tract infections, sexually transmitted infections, and a list of others. Definitely see your doctor or go to the emergency room if you have testicular swelling, a fever, or blood in your semen. However, if the primary issue is pelvic floor overactivity, the solution is not more pelvic floor strengthening, or in other words, more Kegels. So what do we do about this? Treatment is often focused on reducing tension and relaxation. Step 1. Decrease stress to the pelvic area. First, we need to find which activities might be increasing the tone in your pelvic floor muscle. If ejaculation is clearly a trigger, this is something you want to minimize for now. If you find that sitting causes a lot of pressure on your pelvic floor, we would obviously want to spend more time in standing. For men who are high-intensity weightlifters, sometimes we can unconsciously brace or bear down on the pelvic floor as we generate a lot of intra-abdominal pressure. So if you're working out, try to pay attention if you generally feel a little bit worse after a heavy workout. And if so, we need to learn how to gently lift the pelvic floor up instead of bearing down and pushing down on everything. Step 2. Perform gentle perineal releases. Take 2 soft inflatable balls and inflate them to the desired firmness. place them between the sit bones of your pelvis, which are those bony prominences that we sit on. It should feel relatively comfortable. Stay here for a few minutes and perform some deep diaphragmatic breathing. What you want to feel is as your belly expands outwards, your pelvic floor gently drops onto the balls. And what this feels like in a lot of men with chronic pelvic pain is a subtle awareness to that region. Stay here for a few minutes, a few times throughout the day. Step 3, begin a pelvic floor stretching routine. First, we have to understand that the pelvic floor is attached to fixed bony attachments that don't allow for a large range of joint movement. This is why men don't feel a large muscle stretch like if they were stretching their quad muscles. Instead, we need to learn how to do things like use our breath to lengthen the pelvic floor. Just like with the perineal release techniques, by gently breathing into your belly, the pelvic floor muscles descend and lengthen. This is more a feeling of awareness instead of a deep muscle stretch. Specifically, we want to learn how to master the technique known as the reverse Kegel. Start in a 4-point position. Then, you want to think about gently rocking back, moving your butt towards your heels. As this occurs, we want to be mindful of a gentle separation at the sit bones and a dropping and widening sensation. On another note, the erectile muscles are encased in a web of connective tissue called the perineal fascia. Stretching the levator ani muscle group and likely the surrounding areas close to your pelvic floor can play a big role in decreasing the tone of your erectile muscles. Muscles such as your hip flexor, your low back, and glute muscles can certainly impact the overactivity of your pelvic floor. A few ones that would be appropriate would be a standing hip flexor stretch, a child's pose, a figure 4 stretch, and if you're feeling tight in any of these areas, you would definitely want to include them in your stretching routine. If you want to follow along with me on a 5-minute home stretching routine that targets all the muscles that can impact erectile function, click this video up here to get started. And if you like my content, please hit that like and subscribe button to help other men who are struggling with the same problem. Thanks for watching.